Sweetened coffee drinks, including flavored lattes, mochas, frappuccinos, and other specialty beverages, are a surprisingly potent threat to individuals living with diabetes due to their high sugar content combined with caffeine. These drinks often contain large amounts of added syrups, flavored powders, and sweetened milk or creamers, which are concentrated sources of simple sugars. When consumed, these sugars are rapidly absorbed into the bloodstream, producing sharp postprandial glucose spikes. For someone with diabetes, whose insulin production may be limited or whose cells are insulin resistant, each spike forces the pancreas to release substantial amounts of insulin. Over time, repeated cycles of hyperglycemia and compensatory insulin secretion accelerate beta cell dysfunction, exacerbate insulin resistance, and make long-term blood sugar control increasingly difficult. Caffeine in coffee can further complicate metabolic regulation. By stimulating the release of stress hormones such as adrenaline and cortisol, caffeine can increase hepatic glucose production and reduce insulin sensitivity temporarily. When combined with the sugar load from flavored coffee drinks, this can create unpredictable and exaggerated blood glucose fluctuations, making glycemic control even more challenging. These acute effects are compounded by the frequent, habitual consumption of sweetened coffee beverages throughout the day, which can produce repeated cycles of hyperglycemia and metabolic stress. The caloric density of these beverages is another concern. Specialty coffee drinks often contain hundreds of calories per serving, derived primarily from sugar and added fats. This contributes to weight gain, particularly visceral adiposity, which further worsens insulin resistance, promotes systemic inflammation, and increases cardiovascular risk. For individuals with diabetes, who are already predisposed to heart disease, the habitual intake of sweetened coffee beverages can accelerate the development of atherosclerosis, dyslipidemia, and hypertension. Behaviorally, sweetened coffee drinks are highly palatable and marketed to encourage daily or multiple times per day consumption. The combination of sugar, fat, and caffeine reinforces cravings and habitual intake, creating a pattern of repeated glycemic stress. Even moderate portions consumed frequently can cumulatively destabilize blood sugar, undermine dietary management, and reduce the effectiveness of medications. Over weeks and months, this repeated metabolic burden can contribute to progressive deterioration of pancreatic function, worsening insulin resistance, and long-term complications such as nephropathy, neuropathy, retinopathy, and cardiovascular disease. Research consistently demonstrates that added sugars in coffee and other beverages significantly impair glycemic control and increase insulin demand, regardless of the presence of caffeine. Epidemiological studies show that habitual consumption of sugar-laden coffee beverages is associated with increased risk of type 2 diabetes progression, weight gain, and higher rates of cardiovascular complications. Even small servings, if consumed daily, contribute to cumulative metabolic stress, making these drinks deceptively harmful for people managing diabetes. For individuals living with diabetes, sweetened coffee drinks are far from benign indulgences. They are active contributors to rapid glucose fluctuations, pancreatic stress, weight gain, insulin resistance, and long-term vascular, renal, and neural complications. Avoiding or strictly limiting these beverages, opting for unsweetened coffee or drinks with minimal carbohydrate content, is critical for preserving glycemic stability, controlling weight, reducing insulin demand, and lowering the risk of serious, long-term complications. The danger is cumulative, insidious, and often underestimated, making sweetened coffee drinks a deceptively risky choice in the diabetic diet.